In this series of videos, we will talk about the different landmarks for soft tissue structures, articular surfaces for joints, and other landmarks that are important for the configuration of different bones. Please note that each bone is presented in anatomical position. C1, also known as the atlas, lacks a body and spinous process. This ring-shaped bone consists of an anterior arc, which has an anterior tubercle on the external surface, and a small facet for the dens on the internal surface. The posterior arc corresponds to the lamina of a typical vertebrae and has a tubercle that would correspond to the spinous process of a typical vertebrae. You can also see a wide groove for the vertebral artery on the superior surface. The remainder of the ring is formed by the lateral masses from which the transverse processes arise. On the superior surface of the lateral masses are large, concave, superior articular facets that articulate with the occipital condyles of the occiput. It is worth noting that the C1 vertebrae is the widest of the cervical vertebrae. C2, also known as the axis, is the strongest of the cervical vertebrae. The most distinguishing feature of this atypical vertebrae is the dens, or odontoid process, which projects superiorly from the body. The dens lies anterior to the spinal cord within the vertebral foramen of C1 and serves as a pivot about which rotation of the head occurs. There is a small posterior facet for articulation with the transverse ligament of the atlas. You can see that C2 has a wide bifid spinous process. The superior articular facets are large and relatively flat. Here we have examples of a typical cervical, thoracic, and lumbar vertebra. This is the body. We can see that the main difference between the bodies of each vertebra is the size. The body is connected to the vertebral arc by the pedicles, which together encloses the vertebral foramen for the spinal cord. The vertebral arc is made up from a number of structures. This is the spinous process. In the cervical region, the spinous process is bifid. In the thoracic region, the spinous process is long and slender, and in the lumbar region, the spinous process is short and thick. The spinous process connects to the lateral transverse processes via the lamina. The transverse processes of the cervical vertebra have a foramen, which is a foramen for the vertebral artery. Each vertebra has a set of superior and inferior articular facets. Please note that the orientation of the facets for the cervical, thoracic, and lumbar regions vary. This is the sacrum. The median sacral crest are the fused spinous processes of each sacral vertebra. The intermedial sacral crest is medial to the foramen, and the lateral sacral crest is lateral to the foramen. The sacral tuberosity is the proximal extension of the lateral sacral crest.